It is first and foremost an opportunity for all of us to come together to engage with the different stakeholders that are here today from a multitude of different disciplines and sectors to address the common problems that we have. And it's also an opportunity to share in the hard work and research that has been conducted, which generates the necessary empirical evidence that allows policymakers to design and strengthen the programs, for greater impact. As Keith mentioned, you have your research, but you need the research to be able to implement programs on the ground. And then most importantly, the symposium also builds the skills of you, the next generation of researchers and policy professionals, so that you're ready to take on the great challenges that will continue to exist in agriculture, nutrition, and health in the coming years. And since the symposium's inception 4 years ago, I think, as we said, interest in this event has really grown remarkably, and it's really impressive and pleasing to be here for it. And really, this is a testament to both the interest and commitment of people like you who care passionately about addressing these critical issues here in Nepal. And the United States government, through USAID, has made, large evidence-based investments in the nutrition, food security, and agriculture sectors in Nepal under President Obama's Feed the Future initiative and also his Global Health initiative. And all of these investments support the government of Nepal's decades-long commitment to investing in nutrition and the current national multi-sector nutritional plan. So after 5 years of successful implementation, our Suahara 1 program is concluding in September. And by applying research-driven activities to reach 625,000 households in 41 districts across the country, Suahara 1 was one of the first global, programs that was really designed to take the groundbreaking 2008 Lancet series and put it into a cutting-edge integrated program at scale in the country of Nepal. And then awarded just a few months ago, the Suahara 2 Integrated Nutrition Project is now going to pick up right where Suahara 1 left off. And like its predecessor, Suahara 2 really embodies global best practices in comprehensive, integrated, and multi-sector nutrition programming to reach all mothers and infants and young children in 1,000-day households in 40 districts across the country. Again, taking the research that lots of you have been involved in here and putting it into actual practice on the ground. And these programs, of course, complement other USAID investments in agriculture and food security. USAID Nepal's Kisan project contributes to Feed the Future's overarching goal of reducing poverty and hunger. And they do this by reaching more than 500 rural households through agriculture improvements to increase income in the target 20 districts in the far, mid, and western regions. And then lastly, USAID has also invested heavily in supporting food security in Nepal through 2 Food for Peace programs that we have. One is our Sabal project, and the other is Pahal. But the Sabal project aims to build resilience in 11 districts in Nepal and builds upon the same innovative nutrition component and approach that was developed by Suahara. And at the same time, Sabal's program also implements evidence-based interventions in agriculture, livelihood diversification, and disaster risk reduction. And then our Pahal project is also a multi-sector resilience-focused project designed to improve the food security of vulnerable populations in 14 districts in the mid and far west hills and mountains. And they layer and integrate agriculture, livelihoods, water and sanitation, and disaster risk reduction activities as well. And all of these work to support the government of Nepal's investments in these interrelated sectors. So taken together, all of these programs really rely on the research generated by you and other researchers to not only improve the efficacy of our collective activities, but also to tailor global best practices to what actually works here for us in Nepal. And as we know, this is an exciting time for nutrition globally, as many around the world are finally speaking the same language and talking about the multifaceted causes and consequences of food insecurity and undernutrition. I think there's lots of ideas, there's lots of issues, and everybody has sort of been all over the place. And I think for right now, everybody is really more on the same page as much as we can possibly be with so many brains in the room. But however, we know challenges remain. And first, I think reducing and eliminating undernutrition really compels us to avoid working in silos, which is why we're all here today. And stakeholders from a variety of disciplines and sectors, we all must continue to coalesce around our shared commitment to alleviating hunger and improving food security and reducing undernutrition. And then second, the magnitude of the nutrition problem that persists in Nepal are obviously complex, as they are everywhere in the world. But Nepal continues to face a high prevalence of stunting and acute malnutrition and anemia, which continues to perplex us as much as possible. And it further affects, it's further affected by poverty, as we know, which is inequities between social groups, between religions, male and female farmers and women headed households, access to services, Nepali households, and dynamic changes, I think, within Nepali households, especially when it comes to the large outmigration that we've seen in these past years. And then third, we know a lot about the what and the where, what people's eating behaviors are, where food insecurity exists, and where water sanitation and hygiene issues compromise what the benefits of nutritious food can actually do for you or should do for you. And we also know that the interventions that have the greatest impact on nutrition, such as the essential nutrition and hygiene actions, ensuring access to health services, and promoting simple, doable actions to community members, for community members and households and families. So we know those things, but now we need to focus on the why, or achieving a better understanding of what the social and cultural barriers continue to be that prohibit better nutrition within our families. And we must also dedicate time to understanding the how, such as how to continuously improve upon the integration and scale-up of our multi-sectoral programs to reach, especially marginalized families, that, there continues to be a disparity, as we know, out there when it comes to all health, nutrition, and other issues. So then we know that with increased investments in a multi-sector approach into improving nutrition, there's increased need and demand for more empirical evidence and an accurate translation of this evidence into programs and policies. And over the years, Nepal has been, as we know, a model example of integrating the very latest in public health science into national policy and programs. Nepal has a long history of exporting its successful programs to serve as best practices on the global stage. And this includes the vitamin A program, iron folic acid supplementation, chlorhexidine for newborns to reduce infections, and the addition of zinc into oral rehydration therapy for diarrhea. And I would argue that, the next chapter in this rich legacy is the case study of how Nepal's efforts in integrating programming at scale have provided some of the most compelling evidence to date in the field of global nutrition. And so we need to continue the scale up and generation of evidence to enhance the way we think about agriculture and nutrition and how they interact. And then finally, obviously, the policy environment plays a crucial enabling role in reducing undernutrition. And I'm excited today to see so many policymakers and researchers and program implementers and donors from various sectors all in one place to actually talk about this. The world's eyes continue to be on Nepal. Other countries continue to strive to learn from Nepal's successes in the health sector and in achieving one of the world's fastest declines in the prevalence of stunting over the past 15 years. And so now that we've taken care of many of the easy wins, I challenge each and every one of you here to continue to help us understand what it takes to make rapid and sustained progress in this area. So truly, the government of Nepal and researchers like you deserve a great deal of credit for coming so far and for the forward thinking that led the country to develop the national multi-sector nutrition strategy that now really defines our collective priorities for the country. And our partnership and collaboration is really, truly remarkable. So I wish all of you the best in this symposium, and I look forward to seeing the productive results and the presentations that are to come over the next 2 days. Thank you so much.